jump into policy, which is where we left it. Now, the questions that came up out of this conversation, people were sort of worried. And I know you've mentioned that once you get into the symptoms, then you do know that you're deep within it.
Correct.
But then what are the symptoms that I'm going to look out for me to say, well, let me go seek medical help, if indeed I'm already there?
Number one is nausea. Mm-hmm. Okay? And of course, vomiting. Yeah. It's one of the signs. And again, some of these signs are known to be, others. Yes. Let's not forget that there are a number of steps or stages of kidney. Okay? So stage 1, stage 2, you'll never know anything that you've got anything. Never.
In stage 1 and 2,
you'll never know that you've got anything.
You're essentially living healthy.
You're very good. You doing your own things and everything is okay. But by the time now you see your ankles or your feet, there is a lot of swelling in your feet. Yeah. Headache that doesn't stop. Yeah. Frequent urination, which is again, if you talk to experts, for example, on TB and others, so or maybe when coming to urination, you don't urinate much, none. At times you might be having high blood pressure without knowing much.
Yes.
Those are some of the telltale signs of kidney disease. But by the time now they're coming, you ought to be very careful which stage you are. You might be in a very, very high stage.
Yes. Yeah. So that's exactly what I'm looking out for. So somebody asked, is it just going to be about my urine passage that I should be concerned with, especially when talking about kidney disease?
Not really. Uh-huh. There are a number of things. So what happens is that if you go to a hospital to be checked, they'll do very special tests. Mm-hmm. They'll take your blood and they'll take your urine. Yeah. So in the urine, they'll check on the protein, if there are proteins in your urine. Yeah. And in your blood, they'll check on the creatine, what we call the creatine. Reason being, kidney normally is like a flash in our body. Yes. Yeah. And therefore, what happens is that if the flash can't work, one, there'll be a lot of fluids, in your body, including your kidney, including your kidney linings. Number two, even because kidney also help us in coming up with bone, by the way, bone formation. Yeah. And something that I didn't mention, there's something we call osteoarthritis. And I'm sure a number of us know, you've heard of arthritis.
Arthritis, yeah.
Okay? Yeah. And arthritis comes with age. So age is also one of the risk factors to kidney. And it's also a factor to arthritis. Now, the connection between arthritis and kidney is that most of these people that are suffering from arthritis need a lot of non-steroids drugs. So whenever you take a lot of non-steroid drugs, what is happening is that you are increasing the chances of getting kidney disease. So you can't run away from it when you have got arthritis. But the bad or the worst is that when you take them, then high chances again you are going to get arthritis and kidney. And therefore, age is a huge factor. The medication that we take, that's why we are told, don't just take medicine. Always only take medicine prescribed by a doctor. Mm-hmm. Yeah. Another thing is that at times you work for long and you feel like going to urinate, for example. But then you sit for long and say, no, I'll go later. You are making yourself to be at risk of getting kidney disease. Why? Because you are containing this urine. The kidney has done its work by filtering, the fluids, and now you're supposed to go and remove it from your body, but you're staying with it. You are overworking your kidney. Therefore, now whatever is happening now, the process to some extent is stalling, and therefore you are making yourself at risk of again getting. So anytime you feel like urinating, go and urinate.
Yes.
Basically, that is it. Yeah, and let's learn to take more and more water. It's like a filter. If there's nothing to filter, there's nothing to filter, what will happen is things are going to be bad. So always take a lot of water, and that is one of way to clean your system, and the kidney is there to clean your system, to remove the toxins from your body.
Yes.
But then, what if you've got kidney? You know, you've already been, you're known now you have kidney, what do you do? Number one is that you must avoid use of salt.
Completely.
Completely. Number two, potassium. And we get a lot of potassium from our vegetables. And so the best thing to the kidney patients who are watching is that you need to boil that vegetable before you take it. Mm-hmm. So because boiling then do away with potassium. Because what happens is that potassium are some of the elements that then has to be removed from your body. And therefore, because you already have kidney disease,
yes,
you're overworking your kidney, which is so vulnerable to any infection.
Yeah.
Number three, if you've got kidney disease, then you must stop smoking if you're a smoker. Just stop smoking. It's as simple as that. Another thing is that always check your blood pressure, and look at the maximum and the minimum that you are given by your doctor. It's a very, very important to be checking your high blood pressure. I don't know which number now I am.
Yeah, number 4. Mm-hmm.
Overweight. Look at your weight. Check your weight.
Yeah.
If you are overweight, basically you are increasing the chances of the kidney disease progressing to other stages, mm-hmm, which then, the only thing then can be done is either transplant or dialysis. So these are some of the issues that the kidney patients need to know,
yes,
and even the public that are yet to know. Go
need to
for
know the
test.
signs, isn't it? Yeah.
Yes,
mm-hmm,
go for test,
yeah,
check yourself, let be checked. And more so, if you're at risk. And remember, one of the risks, number one is age, and number two, if you've got a family history of kidney disease in your family,
yes,
meaning basically you are vulnerable to also getting the same.
That's it. All right. We'll be joined by senior nephrologist shortly on this conversation. We can go deep, quickly touch on the types that you need to go to on the stages, just for them to understand. Let's